this video, we're going to be reviewing the dead bug progressions using the supine 3-month developmental position. We're going to begin using support for the legs, so it's less challenging for the core to be able to do its job. Before we begin, it's essential that we always establish an initial position where we're ensuring we have correct activation of the abdominal wall and a neutral position for the whole body. We begin by positioning the head, so we're going to create a gentle tuck of the chin down towards the table, activating the deep cervical flexors. We want the chest to open up so that the shoulders can rest on the table. This isn't an act of pulling the shoulders back, but just more of a relaxation of the chest so that the shoulder blades can be resting securely on the table. The legs are positioned so that the knees are flexed a little bit more than 90 degrees. So with the hip joint position here, the knees are going to be up a little higher than the hip joint. We also want to make sure that the knees are positioned about shoulder width apart and the feet are in a little bit from the knees. The next thing we need to take care of is ensuring that we have a neutral position of the chest, which is an expiratory position. So we want the chest to be sitting down towards the table so that she can feel her entire back being supported on the table. We don't want the chest lifting so that we have a dead space under the lower back. This is not creating an abdominal crunch where you are pushing your back down. This is more about relaxing the chest, relaxing the thorax so the chest can be positioned correctly. So from here, I'm going to have her just breathe in, and she's just going to hold her breath in. I'm going to be positioning on her exhale the chest down towards the floor, down towards her pelvis in kind of a 45-degree angle. So as she exhales, and I'm going to position her chest down in there, I'm going to ask her to hold that position, and immediately the abdominal wall is going to activate, holding her chest in the correct position. So there we've established the initial position for the dead bug series. She's going to be moving from this initial position for each part of the exercise. The first step is going to be to create the motor control necessary to dissociate hip motion from mobility of the pelvis and the lower back. This helps give stability when we're walking. So if we were to keep one leg supported on the box, we are going to have her learn how to move her hip independently, one at a time, from the pelvis. We're going to have her imagine that her kneecap is a felt pen pointing towards the ceiling, and she's going to try drawing circles with her kneecap and not allowing her pelvis, her back, to move. At the same time, she's also not stabilizing by pushing this leg into the box. So we're going to be moving this one at a time, independently of the rest of the body. So she's going to lift and begin moving into circles. And while she's doing that, I want to make sure that she's maintaining that pressurization of the abdominal wall, and also that she's keeping the pelvis and the chest in that relative position of neutrality and not letting herself move. Now she's moving a little quickly, so we're going to slow this down. And we also want to make sure that it's not foot motion, so we're not creating that type of motion. But the foot, the knee, and the hip always stay in that same relative position, and she begins making circles like so. So she's going to practice doing that in a few circles in one direction, and then we're going to reverse that and try the opposite direction. And then if she wanted, we could have this leg rest, do the same thing with this one. The next step then would be to do the exact same exercise without the opposite leg being supported. So we would take this one in the air, and she would do the same circles with the other leg. This is obviously going to be a little bit more challenging, a little bit more demand on the core to create that stabilization of the pelvis and the trunk, a little bit more motor control to be able to separate the two. So again, I need her to slow down, really focus on isolating the motion, And again, keeping pressurization through the abdominal wall, and throughout the entire exercise, there's no breath holding. We need to keep breathing down. Now we can see that because this exercise is a little bit more challenging, we're starting to draw the chest in. So we need to create that relaxation, ensuring that the shoulders stay back towards the table, tucking the chin down. We don't want to see gripping up into the neck or in the chest while we're creating isolated movement of the hip. So that would be a level 2 exercise. For a level 3 exercise, we're going to be performing in the same position, but without any leg support. So from here, we're just going to bring the legs back up into that same initial position we were before. But now we're going to be creating a little bit more range of motion through the lower extremity. Still keeping the same relative position of the pelvis to the chest, the neck stays tucked, shoulders remain resting firmly on the table. She wants to feel from the back of her sacrum all the way along her spine to the back of her head, sitting securely on the table. From here, she's going to begin to reach down with her leg. We're only going to move one extremity at a time at this level, and she's going to reach down this way as far as she can, again keeping that same relative position of the hip to the knee, to the foot, without rotating outwards while she's reaching down. And she's only going to reach as far as she knows she can maintain that control through here. It's pointless that if we're reaching the leg down so far that the pelvis begins to move with it and the back begins to arch. And that's something we see quite often in dead bug exercises. People are more focused on how far and how fast they can move their extremities, but there's absolutely no control through their midsection whatsoever. So she's going to go ahead and reach with the other leg, reaching down. Now you can simply hold this position and breathe anywhere from 5 to 12, maybe 15 good abdominal breaths through the cylinder. You can hold it less and just do very slow repetitions. And then bringing it back, and again, the whole time, maintaining that pressurization, pushing out in the front, the side, and the back, breathing through all those areas as well, keeping the chest relaxed, the neck tucked down. So that would be a level 3. In level 4, we're going to begin incorporating upper extremity and lower extremity motions, learning how to dissociate shoulder movement from that of the thorax. So we're going to bring the arms up into position. We don't want to be reaching so far that we start to pull those shoulders off the table. And so we're going to have her simply do the exact same motion with one lower extremity, and the opposite upper extremity is going to be reaching as well. And I'm going to be watching to make sure we don't have separation of the chest from the pelvis. And we can do a simple hold for several breaths or slow repetitions back and forth. And the opposite. Keeping that relative position of the foot, knee, and hip. And while she's reaching back, we want to make sure that the chest isn't lifting up with the arm, and we're also not gripping with the pecs, we're not clenching the jaw, we're not gripping with the neck muscles. She should feel the pressurization all the way down to her pelvic floor. Very good. And back. And that would be a level 4 exercise. In the dead bug progression, we can also use therapy tools such as stability balls or kettlebells. So we're going to position the ball resting on her chest, and she's going to bring her legs back up into that exact same initial position we started with. Again, feet slightly in from the knees. Her hands are positioned on the ball. So what she's attempting to do right now is take all 4 extremities and press in towards the dead center of the ball. So the knees and hands are pushing in this way, like so. She's has already established her neutral position of her chest, her neck. She's pressurized her cylinder. Now, if she was to move this foot in the opposite arm, The contra extremities are going to be supporting the ball while she reaches. Now this is a great way to help maintain that neutral position of the chest and the pelvis while the extremities are in motion. And she's working a little harder to create that compression of the ball. But at the same time, we're really working hard to not create an abdominal crunch. So we're not crunching into the ball, we're using intra-abdominal pressure to stabilize the abdominal cylinder so that we can create that compression through the extremities. And again, we can reach and hold for several breaths, or we can just do slow rhythmical alternating movements. So alternative to an exercise ball, we can also use a kettlebell. So before I hand her the kettlebell, I'm going to have her move back up into her initial position. We want to make sure that chest stays down, chin is tucked, and I'm going to place the kettlebell in her hand. Now to do this, we don't want to be gripping the kettlebell tight, because as soon as you grip with your hand, there's a tendency to also activate the chest muscles. And we want to create relaxation of everything outside the core. So I'm going to place the kettlebell in her hand, and she's going to keep her hand open and relaxed. Now we're going to be using the weight of the kettlebell to challenge the core, to challenge those oblique slings of the core to maintain a neutral position of the pelvis and the thorax. So she's going to go ahead and reach with one leg in the opposite arm, keeping that same relative position of the lower extremity. As she's reaching, she's working even harder to maintain that neutral position of the chest. The weight is wanting to pull her chest towards her hand, so that oblique chain from this side down to here has to work even harder to maintain that neutral position. She can hold that position for several breaths, or she could even do rhythmical motions of one oblique chain versus the other. In this case, she's going to switch sides between. Very good. And as always, maintaining that pressurization all the way down to the pelvic floor, from the front all the way to the back, and continuing to breathe through the whole exercise, never holding the breath. So that would be considered, the ball and the kettlebell would be considered like level 5 exercises. Now for some people, they may struggle with being able to keep that neutral position of their chest while their arms and their lower extremities are in motion. And we can use a weight plate to help facilitate neutral positioning of the body and also facilitate activation of the core. So she's going to go ahead and bring her legs back up into that same neutral position. She's going to do everything else she's done before about creating that neutral position through the pelvis, the chest, and the neck. And I'm going to hand the plate to her. And she's going to reach only as far up in the air as she's able to maintain that the shoulder blades on the table. We don't want to be reaching so far that we start pulling ourselves off the table, because it's important that the shoulder blades remain down as they're part of your support. So she's going to pull the shoulders towards her hips. We don't want to have any shrugging of the shoulders either. And then from here, she's going to go ahead and just reach with one leg. Exact same technique as the other exercises, and she's using the weight of the plate to help stabilize her upper body. Very well. Now we can go one step further than this, and while one leg is reaching, we can really challenge her core by having her reach with the plate over her head as well. This is a very difficult exercise to do. She's going to hold and breathe and breathe and breathe. And I can stand here all day watching her work, because this is no effort for me. Hold it a little longer. A little longer. Oh, a little longer. Very good. There you have the dead bug progression performed in the supine 3-month developmental position. Thank you.